Welcome to BreastScreen WA. Today we're in the David Jones Rose Clinic, which is located on level 3 of the David Jones City store. BreastScreen WA is a Western Australian Department of Health service that provides free screening mammograms to women aged 40 years and over. A screening mammogram is an X-ray of the breast tissue and can show early changes which may indicate breast cancer. Screening mammograms may detect up to 90% of breast cancers and are the best way to detect early breast cancer. They can even detect breast cancers as small as a grain of rice. There are some breast cancers that cannot be seen on a mammogram. Younger women or women on hormone replacement therapy may have much denser breast tissue than older women, and this may make it more difficult to identify a cancer on the mammogram. Having a mammogram cannot prevent breast cancer, but early detection provides the best chance of successful treatment. The David Jones Rose Clinic is located centrally in Hay Street Mall and is a great option for women who work in the city. When you arrive for your appointment, the receptionist will check your personal details and ask you to read the notes on screening mammography before you sign a consent form. The notes on screening mammography provide important information about mammography screening and explain how the mammogram will be taken. The receptionist will then show you to the change room where you'll be asked to remove your bra and put your top back on, or a disposable gown is available if you require. A specially trained female radiographer will then call you into the X-ray room. She will again confirm your name and date of birth before asking you some questions about your medical history. You'll be asked if you have any family history of breast cancer, a personal history of breast or ovarian cancer, or whether you've had any procedures to your breast, such as a biopsy or cysts drained. 2 X-rays will be taken of each breast, one from the top and one from the side. The radiographer will then ask you to remove your top. She will carefully position and compress your breast on the X-ray machine. Compression will be tight and a little uncomfortable, but should not be painful. You should let the radiographer know if it is too tight. Compression is very important to keep the breast still and the tissue spread out so the whole breast can be seen on the X-ray. When the radiographer has taken the mammogram, she will check the images on the screen for technical quality. The images will be then sent electronically to our head office where they will be read by at least 2 radiologists. You'll be given a leaflet explaining what happens next and you'll be free to go. You should receive your results letter within 2 weeks. Very occasionally, the radiologist will request a repeat X-ray if the image is not clear enough. If you require further tests, a breast assessment nurse will phone to discuss this with you and arrange for an appointment at Royal Perth, Sir Charles Gardner or the Bunbury Breast Assessment Clinic. If you are a woman 40 years or over with no breast symptoms, you can have a free screening mammogram at any BreastScreen WA clinic. BreastScreen WA has 9 metropolitan clinics and 4 mobile units which visit over 100 towns throughout rural and remote WA. There is also a regional screening and assessment clinic located at the South West Health Campus in Bunbury. If you are experiencing any unusual breast symptoms, please see your GP. Our service is specifically recommended for women 50 years and over, as more than 75% of breast cancers occur in women in this age group. BreastScreen WA recommends women 50 years or over have a free screening mammogram once every 2 years. Once is not enough. If you have a significant family history, you may be eligible to have a free screening mammogram every year. But remember, 9 out of 10 women who develop breast cancer have no family history.